In this section of Pain 101, I will be discussing chronic pain. I will be discussing common causes of chronic pain and various options available to help relieve and potentially alleviate your symptoms. According to the American Pain Foundation, chronic pain affects 42 to 50 million Americans. Chronic pain is typically defined as pain or progress over a period of time lasting more than 6 months. In this case, the experience of pain extends beyond the normal expected healing time for an injury and can ultimately interfere with someone's normal daily activities. This pain can vary greatly, ranging from mild to excruciating, episodic or continuous, merely inconvenient or totally incapacitating. Some cases of chronic pain can be traced to specific events. For example, an injury, an infection, or even a surgical incision. Other cases seemingly have no apparent cause, including no prior injury and/or an absence of underlying tissue damage. There is also an emotional component of chronic pain that can take effect. Anxiety, stress, depression, anger, and fatigue can interact in complex ways with chronic pain that could potentially make it worse. Any of these negative feelings can increase the level of substances in the body that amplify the sensations of pain, thus creating a vicious cycle of pain for an individual. There are several causes of chronic pain that I will be discussing in this Pain 101 course. The first are past injuries. If an injury does not heal correctly or is not properly treated, this may lead to compensation in an individual's ability to perform everyday activities. Compensations over time will place additional stress on other body parts, leading to a more severe injury or leading to other injuries. It is important to take care of an injury when it happens and seek the appropriate treatment before the injury becomes chronic and more severe. The second is poor posture. Abnormal posture can lead to strength and flexibility imbalances in the body, which over time will place stress on certain structures in the body that are not designed or capable of handling these added forces for prolonged periods of time. This can lead to chronic injury and pain in the muscles or joints of the body. So for example, here's a model of the spine, and if you have a tendency to sit or stand with your spine to flex, so bent in this position, it can put a lot of stress on the small joints in the spine and also the tissues that run along the length of the spine as well. So as you can see on this model, for example, if you were to sit like this for most of the day at work or at home, the long muscles that run along the length of the body can be under a lot of tension in this position. The third is being overweight. This can place an excessive strain on the spine, knees, and ankles that can lead to chronic pain over time. The first will begin with the spine. So this can either be in the lower back, here on our model, up towards the neck, up in through here. Can also be sciatic pain, which is generated from the nerves that come off the lower part of your back and radiate down your leg, or also headaches, which are often generated from the top of your neck up in this region. When these or other orthopedic conditions are not resolved, they may become chronic and lead to significant pain and dysfunction. Pain in the spine that is not resolved over time can become a chronic problem, leading to increased pain and significant loss of motion and strength, which can lead to limitations on one's daily activities. Next is arthritis. This can include either osteoarthritis or rheumatoid arthritis. Osteoarthritis occurs when there is degeneration of the cartilage that cushions your joints. So here on this spine model, there can either be degeneration of the discs that separate each vertebral segment or of the actual bony part of your vertebrae as well. On this other model, you can see on here that this represents a healthy disc and a good disc height. Lower down, you can see where degeneration has occurred and the space has narrowed, and this can lead to significant pain. Rheumatoid arthritis is an autoimmune disorder that typically affects the small joints of your hands and feet. Unlike the wear and tear damage of osteoarthritis, rheumatoid affects the lining of your joints, causing painful swelling that can eventually result in bone erosion and joint deformities. Both forms of arthritis can lead to significant and chronic pain and limitation in one's joints. Next is fibromyalgia. This is characterized by widespread muscle and joint pain as well as fatigue. The cause of this disease is not well understood, but many believe this condition amplifies painful sensations by altering the way your brain processes the pain signals it receives. This chronic condition can lead to frequent pain, weakness, and limit one from performing their normal activities in their life. Next is neuropathy. Nerve damage can be caused by several factors: traumatic injuries, infections, metabolic problems such as diabetes, or exposure to toxins. There are also several orthopedic conditions that can lead to nerve damage and potentially chronic pain, and these include disc herniations in your spine. So this is where the discs that sit in between each of your vertebrae, and if they bulge, they can pinch the nerves that exit your spine. Also stenosis, which is a narrowing of the bone where the nerve exits. And also what can happen is a nerve entrapment, so a nerve can get caught along its pathway down either your arms or your legs. In each of these conditions, prolonged compression on a nerve can lead to significant or chronic pain that can potentially radiate down any of your limbs. In addition to pain, over time, it can also lead to weakness or numbness and limit one's ability to perform daily activities. The solution to your chronic pain depends on the source of your pain and the type of injury you have sustained. The first step is to consult with your doctor and discuss their recommendations for treating your pain. Your doctor may recommend restrictions on specific activities, medications, and/or physical therapy. You can also try the following steps now to help alleviate your pain. First is heat. Heat can be applied to help the muscles relax, which can decrease your pain. To prevent damage to your skin and surrounding tissue, it should only be applied in 15-minute intervals. Next is stretching. Increasing range of motion and flexibility will help decrease the stress on certain areas of your body that are unable to withstand the forces that are contributing to your chronic pain. Next is exercises. Remaining in the same position for a prolonged period of time or being sedentary can increase stiffness and pain. Activities that require physical exertion are beneficial to get your body moving and treat chronic pain. It can include walking, swimming, biking, and other forms of functional strengthening. Next is medications. Over-the-counter medications such as aspirin, ibuprofen, and Tylenol, as well as medications prescribed by your physician, can be taken for short-term relief of your symptoms. If you continue to experience pain or problems, then physical therapy may be your best option. Physical therapy is a very safe and effective way to treat this condition. Physical therapy consists of hands-on treatment to loosen muscles and joints, education on proper posture and movement to decrease pain, instruction on stretching and strengthening exercise to restore mobility and strength, and modalities such as electrical stimulation and heat to help the affected area heal. If the information and exercises provided on this website are not helping and you continue to have pain, please call our office for a free consultation. Our friendly staff will then quickly schedule you for your free consultation with no obligation on your part. It will be a time for one of our physical therapists to sit down with you and perform a brief evaluation to determine the exact source of your pain and what needs to be done to help you. I hope this Pain 101 course on chronic pain has been helpful.